Nigeria continue to contend with cholera outbreaks, with cases spreading across 35 states and the FCT. The Nigerian Center for Disease Control and Prevention (NCDC) Cholera Epidemiological Summary update as of October 13, 2024 puts the total number of cases at 14,237 and 378 fatalities recorded this year. Worrisome statistics there. The Federal Executive Council in June 2024 constituted a cabinet committee on the control of the cholera outbreak in Nigeria, with the coordinating Minister of Health and Social Welfare, Professor Ali Pate, as the chairman, and membership cutting across relevant ministries.
To think together as to what do we do immediately to help numb this outbreak so that it doesn't get out of hand, and also begin to lay the foundation for preventing such occurrences of infectious disease outbreaks.
The number of suspected cholera cases and deaths in 2004 has more than doubled when compared to this time last year. And that is where we are extremely worried. These numbers reflect the severity of the outbreak and reinforce the need for continuous vigilance and action.
The issue of open defecation in our community is also a challenge. It's one of the causative agents of this waterborne disease, cholera. And we are campaigning that state governors, local government chieftains will also take this advocacy.
Health experts in national response to cholera control wants governments at the sub-national levels and sanitary authorities to intensify awareness and other measures. In Abuja, Olusheye Adiagbo, NTN.
Lagos, we hear, is among states battling with the outbreak of the cholera. Though it didn't linger for long, but it's still there. In this report, Hingino John Adams tells us how the state responded to the situation, as well as what the state government is doing to address the challenge of potable water.
Few months ago, Lagos State was faced with an outbreak of cholera which claimed some lives. This caused apprehension among residents, but with swift action from the state government, the numbers dropped to zero.
You must be aware to support government by ensuring your own safety. Consume only safe water that is boiled, bottled, or sachet.
Even with the success story, some people are still vulnerable. John Obasi is a resident of Maridon Orile, one of the settlements being affected by perennial flooding in Lagos. Among multiple challenges faced by him and members of the community are waterborne diseases like cholera.
Because of the waste and other things that people throw inside. So when the water comes, it brings those things out and people put their leg. And before you know it, they start vomiting, start stooling and other things.
Apart from commending the government for proactive measures towards curbing the spread of the disease, experts are calling for urgent attention while advocating proper water sanitation and personal hygiene, as prevention, they say, is better than cure.